Coming out of the shutdown in December, we were given a new sense of hope for life going forward. Scientists were inching closer and closer to a potentially life-saving vaccine. And by the end of December, the first vaccine was approved. And the Trump Warp Speed project was successful.
The Trump administration established these vaccines, which are truly miraculous, life-saving, and largely effective against this virus, even the new strains.
The Pfizer vaccine started shipping across the country.
The transition team is still getting up to speed on Operation Warp Speed.
There is no detailed plan.
Do you think the COVID vaccine should be mandatory?
No, I don't think it should be mandatory. I wouldn't demand to be mandatory, but just like I don't think masks have to be made mandatory nationwide.
Do solemnly swear that I will faithfully execute the office of President of the United States.
The president failed to reach his 4th of July goal to vaccinate 70% of U.S. adults. On Sunday, he touted the country's success in vaccinations thus far, but then stopped short of declaring victory over the virus.
Today, we're closer than ever to declaring our independence from a deadly virus. That's not to say the battle against COVID-19 is over. We've got a lot more work to do.
This administration was woefully unprepared when the Omicron variant arrived. It was a scavenger hunt for testing. Long lines, empty shelves.
Health officials are reporting more than 100,000 infections per day for the first time since early October.
It is believed to be the Delta variant, driving a new wave of cases across the U.S.
Meanwhile, the new Omicron strain is also spreading rapidly.
Now spiking across 39 states and D.C., cases doubling every 2 to 3 days. Today, long lines for testing. New York City bracing itself with a spike in numbers. In Florida tonight, an eye-opening finding in Orlando. Omicron is already making up nearly 100% of wastewater samples taken this week. It went from 0 to nearly 100% in a week. Today, the president meeting with his COVID response team.
The whole point is Omicron is here. It's going to start to spread much more rapidly at the beginning of the year. And the only real protection is to get your shots.
Hospitals already overwhelmed by the Delta surge could reach their breaking point. In Wisconsin, just 3% of ICU beds are available.
We're stressed, we're burned out. We want to take care of the patients that come here. But I'm telling you, we're so exhausted and frustrated.
I know this remains frustrating. Believe me, it's frustrating to me. But we're making improvements. With more capacity for in-person tests, we should see waiting lines shortened and more appointments freed up.
Our hospital beds, and more importantly, our hospital ICU beds are filling up, and in some states are completely full.
Our patience is wearing thin, and your refusal has cost all of us.
President Biden this evening trying to get Americans to get vaccinated. The president unveiling his 6-point plan to stop the spread of COVID. At the top of the list, vaccine requirements impacting as many as 100 million Americans.
An outbreak at Cornell University now topping 1,000 cases, many of them Omicron.
It was definitely a surprise since I am fully vaccinated, but I do realize that that's still a risk, so I was still trying to be cautious.
If you are vaccinated and boosted, you may get COVID, but you are highly protected against severe illness.
Vaccinated people who do have a breakthrough infection are clearly capable of transmitting the infection to an uninfected person.
Tonight, Stanford University, just the latest school to go remote and require booster shots for the spring.
There's no excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated.
But I think what you'll be seeing is universities and colleges and some large employees or even small employees will say, if you want to work in this enterprise or in this institution, you'll have to show proof of vaccination.
In an effort to boost vaccinations, the new rule mandates all employers with more than 100 workers get vaccinated or test weekly for the virus.
The way the Biden administration is trying to enforce the rule is through the Labor Department and OSHA.
The employer may decide to file an action against OSHA, ask a judge to say that this particular requirement you're imposing on us to make us then require our employees to get vaccines or get tested. You can't do that.
If you're vaccinated and boosted, you are highly protected.
9 people have died from thrombosis out of 17 million shots. The blood clots were more common in women in their 30s and 40s. It comes as health officials are pleading with Americans to get vaccinated and boosted.
Not only is it one of the toughest mandates in the country, New York is now believed to be the first city to require vaccines for all workers. And now children here as young as 5 will have to be vaccinated before any indoor dining or entertainment.
Federal judge has ruled that President Biden cannot require teachers in federal Head Start early education programs to be vaccinated against COVID. The ruling is considered a victory for the 24 states that sued the Biden administration. The surge in the Omicron variant of the coronavirus shows no signs of slowing down. The average number of new daily cases is more than 386,000.
Yeah, we still don't know how effective our current vaccines are against Omicron.
We're already at a point where we're running out of the meds that we use for these patients as well as beds.
COVID records get broken daily.
The speed at which Omicron is spreading is staggering.
More worry spots, hospitals overwhelmed by sick patients and sick staff. On COVID's front lines, the Pentagon has sent reinforcements into hospitals in Wisconsin, Montana, and Michigan. Many doctors say avoid going to the ER, often a COVID hotbed, especially for children. Across COVID America last week, almost 400 children a day were hospitalized for the virus. That's a 66% increase from the week before.
Be concerned about Omicron, but don't be alarmed. Because of the strategy we executed over the past year on vaccinations, testing, treatments, and more, we're now in a new moment in this pandemic. Does not mean that COVID-19 is over. It means that COVID-19 no longer controls our lives. That's what it means.
I think we will approach 1 million deaths here.
Cases are ticking up as we thought they might.
Essentially, in order to maintain trust, he needs to acknowledge some failure here.
We got to work and we delivered. Enough vaccines for every American, months ahead of schedule. Effective treatments, at-home tests that are free and accessible.
We've ordered too few testing kits, so our testing capacity has continued to lag behind each wave. It's too little and too late. We've ordered too few and too little treatments.
That has been a major problem of getting rapid tests out there so that they can actually be useful in helping stop the spread. And those PCR tests are great, but the results for those were often very slow. And so if you took a test and then didn't get results for 4, 5, 6 days, sometimes even more, that does you almost no good in trying to know whether or not you're contagious at this moment. That's what rapid tests are for. And as we have seen, the deployment of rapid tests has come very, very late. And that is still a big sore spot for this administration and a subject of much criticism.
It took months to ramp up our testing capacity. And with Omicron, we saw how vital it was. And we have enough tests on hand to weather the surge. But without funding, we're not going to be able to sustain the testing capacity beyond the month of June. And if we fail to invest, we leave ourselves vulnerable if another wave of the virus hits.
If we talk about Biden's push for more COVID funding, the federal dollars that cover things like testing, for example, that money's dried up at this point.
Well, it's about $32 billion in funding, and the administration is saying that they need this money to make sure that this infrastructure that the administration has put into place to respond to COVID that they feel has worked relatively well and is in place.
Thanks to the foundation we've laid, America has the tools to protect people. But now, just as we've reached the critical turning point in this fight, Congress has to provide the funding America needs to continue to fight COVID-19. We're already seeing the consequences of congressional inaction.
In a crisis, which is what this is, clear and consistent messaging, telling people what you know and don't know, and acknowledging mistakes and moving on are the 3 keys to maintaining trust. And if you break any one of them, you'll have a harder time with the underlying core response plan and its execution.
Americans are back to living their lives again. We can't surrender that now. Congress, please act. You have to act immediately. The consequences of inaction are severe. They'll only grow with time.
1 million deaths, getting close to 1 million Americans that have lost their lives is really unfathomable.
In case there is a new surge, they want to be prepared for that, and they're saying that this is something, if it's not passed, that won't happen.